Hello friends, I'm so happy you're with us today. Today we're going to talk about two illnesses that confuse a lot of people, schizophrenia and bipolar disorder. These two mental disorders are often mixed up, but they are very different from each other. Both affect the mind and mood, but in different ways. Schizophrenia affects how someone thinks and sees reality, while bipolar disorder causes big changes in mood. In this video, we'll look at their similarities and differences to understand them better. We'll check out the symptoms, causes and treatments for each of these disorders. We'll talk about the symptoms, mood changes, thoughts and behavior each illness shows. For example, with bipolar disorder, people might have times of great happiness and energy, followed by times of deep sadness. On the other hand, schizophrenia can include seeing or hearing things that aren't there, strange beliefs and jumbled thoughts. These differences are important, so we can better support people living with these disorders. And with simple examples, we'll see how they are different. We'll use everyday situations to explain how these disorders might look in real life. We hope this video helps you understand these two important mental disorders better and recognize their signs. Schizophrenia is a disease that affects the mind and makes it hard to tell what's real and what's not. It's not as common as bipolar disorder, and usually shows up in young people. Doctors don't know exactly what causes it, but it seems like both genes and the environment play a role. Schizophrenia shows different symptoms in each person. Some of the most common are seeing, hearing, smelling or feeling things that aren't there, hallucinations. Having strange ideas that are not based in reality, delusions. Getting your thoughts mixed up and not being able to speak clearly. Losing interest in things you used to like. Isolating yourself from others. Bipolar disorder, which used to be called manic depression, brings big changes in mood. Sometimes you feel very happy, mania, and other times very sad, depression. Like schizophrenia, bipolar disorder needs treatment so the patient can live a better life. In bipolar disorder, mania and depression come and go. These mood swings can be unpredictable and affect every part of a person's life. Mania and depression aren't just feelings. They can affect thinking, behavior and physical health. In mania, you feel like you're flying, full of energy and confidence. You might feel unbeatable, like you can do anything. This extra energy can make you take on more than you can handle. You might not sleep much, talk fast, or do impulsive things. Your thoughts race, and you might find it hard to focus on one thing at a time. This overactivity can lead you into risky situations and make risky choices. You might spend money carelessly, get involved in dangerous activities, or make decisions you wouldn't normally make. In depression, you feel awful, hopeless. The energy and confidence disappear, leaving you feeling empty and without hope. This state can make you pull away from friends and family. And nothing brings you joy. Even activities you once enjoyed might seem pointless. Depression can affect your ability to function in daily life. Your appetite might change, your sleep might change, and you might feel tired all the time. Mood changes can affect your body, causing problems with sleep and appetite. And you can't focus. Thinking can get cloudy, and you might find it hard to make decisions or finish simple tasks. And think bad things. Negative thoughts can become overwhelming, leading to feelings of worthlessness and hopelessness. It's important to seek help and support to manage these situations. In both illnesses, mood changes, but in a different way. In schizophrenia, emotions might be out of place, for example, laughing at a sad story. In bipolar disorder, the changes are more intense, from extreme joy to deep sadness. In schizophrenia, thoughts are jumbled, and the patient finds it hard to tell what's real from what's not. They might hear voices or believe they are being watched. In bipolar disorder, thoughts are more organized, though fast during mania. The patient might have too much self-confidence and believe they can do anything. Schizophrenia and bipolar disorder also affect behavior. In schizophrenia, the patient might be still, not react, or take on strange postures. In bipolar disorder, behavior changes depending on the phase. In mania, the patient is overly active, talkative, and impulsive. In depression, they look like someone with depression. Let's look at some examples. Schizophrenia is a serious mental disorder that affects how a person thinks, feels, and acts. Maria thinks the TV is talking to her and giving her orders. These hallucinations make her feel constantly threatened and uneasy. She's afraid to leave the house, believing someone is watching her. This paranoia keeps her shut in, isolated from the world. Bipolar disorder is another serious mental condition marked by extreme mood swings. George, in a manic phase, spends all his money gambling because he thinks he won't lose. His excessive confidence leads him to risky decisions. In a depressive phase, he shuts himself in at home, feeling hopeless. He has no energy or desire to do anything, feeling like his life has no meaning. Schizophrenia can cause serious problems with communication and how one sees reality. Costas talks nonsense and thinks aliens are chasing him. These strange beliefs make him live in constant fear and anxiety. Bipolar disorder can affect a person's ability to function normally in their daily life. Eleni, in a manic phase, sleeps very little and starts many things at once without finishing them. Her excessive energy and inability to focus make her lose control. In a depressive phase, she has no strength to get out of bed. The feeling of hopelessness and weakness keeps her down, making her feel like there's no way out. These examples show how serious and damaging these mental disorders can be for the lives of people who experience them. It's important to understand and support these people, offering them the help and understanding they need. Schizophrenia and bipolar disorder are two different illnesses, even though they have some things in common. A correct diagnosis from a doctor is very important to get the right treatment. With medicine, therapy and support from their loved ones, people with these illnesses can live a good life. This video gives general information and is not a substitute for medical advice. If you or someone you know is dealing with mental health issues, please talk to a specialist.